I had the good fortune of participating in my first vaccine clinic last Friday evening, administering vaccines at St. Catherine University, where I work. As a faculty member, we were vaccinating students, student nurses, students studying respiratory therapy, occupational therapy, physical therapy, students that were going into our hospitals and healthcare centers to do their clinicals, to learn to care for people, and they needed the protection of a vaccine. I was really, really grateful, and at the end of our shift, the nurses with whom I was working, stood together, and in that small conversation, I felt the first strains of hope from a group of healthcare providers who probably understand in ways unlike others here about the ravages of this disease on people, and seeing maybe the beginning of light at the end of a tunnel when more of us will be vaccinated and when more of us can return to life together without our masks, life together in our communities, with our families and our friends, and I, for one, can hardly wait for that time. And then I saw the news yesterday from the Department of Health about rising case counts again in southern Minnesota and in northern Minnesota, and one of my physician friends reached out to me last night to remind me once more that we could be likely facing another surge in the state of Minnesota, and to keep my mask on, to stay vigilant, to stay healthy, to stay safe. It's been a year-long now pandemic. I remember March 13th, my birthday, coming up in case anybody wants to know, was the last day that I was in a bar, Sweeney's, in the district I represent, with people having a beer to celebrate, and shortly after that came the stay-at-home orders. It has been a long year, a lot of suffering for people in Minnesota in all sorts of ways. We know now that we've lost more than 500,000 souls in America to this disease, and many have lost in their many ways, their livelihoods, they're living in social isolation, they're lonely. In many ways, people are suffering. This body, before I was elected to it, has met countless times in special session, debating peacetime emergency powers. And in those debates that I have watched, I have not seen meaningful protections advanced for people who are working on the front lines. I have not seen a meaningful effort on the part of this body to bring us together to defeat the virus. And if I were to do a nursing diagnosis of what we're experiencing right now, it would include a political division that is causing an increase in illness and death. Because when we lead in a divided way and send mixed signals to the people, they pick up those signals and act in division as well. And today is another one of those days. In April of 2020, Congress took important action to protect frontline workers who were going to continue to work in the course of the early stages of this pandemic when we didn't really understand the disease very well. So healthcare workers and grocery store owners, grocery store workers, first responders, all continuing to work. And the Congress said, we need to put some protections in place for those frontline workers. They passed FCRA, the Families First Coronavirus Response Act. And they made sure in FCRA that employees all had 2 weeks, 80 hours worth of paid emergency leave in case they needed to quarantine, in case they needed to leave work to care for an infected family member, in case they needed to care for their child because their child care provider was sick. FCRA extended to some but not all employees in Minnesota. And when I look at Senate File 1, there are 2 conditions that are added for businesses to participate in an effort to say it's safe to be open again. I would like to add a 3rd condition. And Mr. President, I have an amendment. I have the A11, and I'd ask for a roll call, please.
Senator Murphy offers the A11 amendment. The Secretary will report the amendment.
Senator Murphy moves to amend Senate File number 1 as follows, page 1, line 16, delete, and this is the A11 amendment.
A roll call has been requested. A roll call will be granted to the A11. Senator Murphy.
Thank you, Mr. President. Members, this is an amendment for Minnesotans workers All it says is that employers that are opening up during the course of the pandemic must provide 2 weeks of emergency leave for their workers. It's required. It includes a civil penalty if not applied, and I'd ask for your support. Thank you very much.